Each year in the United States, 1.3 million people are cared for in over 15,000 nursing homes. These nursing homes provide complex care to residents who are at risk for infections and hospitalizations. With 1 in 6 Americans over the age of 65, there is an urgent need to optimize nursing home care.
I wanted to understand how multi-drug resistant organisms, or MDROs, are spread between hospitals and nursing homes. In hospitals, about 10 or 15% of people have an MDRO. In nursing homes, that number is a staggering 65%. We wanted to find simple solutions that would protect all these people from an MDRO infection. The PROTECT trial was a 28 nursing home randomized trial that was federally funded and asked whether or not switching out routine bathing soap with an antiseptic soap called chlorhexidine and cleaning out the front of the nose so that bacteria would be removed by iodophore or a povidone iodine swab could reduce multi-drug resistant organisms in the nursing home and also reduce hospitalizations. We found that chlorhexidine soap and nasal iodophore reduced multi-drug resistant organisms by 30%. Even more remarkably, we found that it prevented almost 2 infection-related hospitalizations per month per 100-bed nursing home.
Chlorhexidine and nasal iodophore are both compounds that decolonize persons. Chlorhexidine is more effective at killing germs than soap and water. The other thing that's really unique about chlorhexidine is that it binds to the skin. And when it binds to the skin, it not only continues to kill the germs that may live on the skin, especially the bad germs, but it also prevents bad germs from recolonizing or coming back onto the skin.
One of the greatest challenges in long-term care medicine is a lack of evidence-based literature. So when I first heard about the PROTECT trial, I was really excited. And when I saw the results of the PROTECT trial, I was even more excited. And so the idea of developing a workflow that could be taught and trained, but also could have an impact on reducing infections, reducing hospitalizations, and hopefully even reducing mortality is something that I think any of us who work in the nursing home setting would be very excited about.
It's easy to assume that bathing is intuitive because we've been doing it all of our lives. But the truth is many nursing home residents have skin that's not completely intact, and it makes staff afraid to clean those areas. Unfortunately, those are the most important areas to clean, and that's how we prevent infections. This is why we have a CDC-funded project called Embrace to develop innovative modules for direct-to-staff learning. In these modules, we teach people how to give a 4% rinse-off shower with chlorhexidine or a 2% leave-on bed bath. In addition, we remind people how important it is to really rub the chlorhexidine into the skin so that it binds the skin proteins, much like you would remove dirt or grime or sweat.
I'm a big believer in the chlorhexidine and the nasal iodophore. It really made a big difference in our residents' lives. It reduced infections, our antibiotic usage. If you really train your nurses and your CNAs how to properly bathe and take care of the residents, the benefits are immense.
So innovative direct-to-staff training modules take into account the effective intervention that we've learned about and the potential barriers to implementation. And what they're able to provide to nursing home staff is information about that intervention and provided in a way that fosters unity across the healthcare team and allows those staff to walk away with a certificate to show their continued dedication to learning. CDC is continuing to work to raise awareness of these exciting interventions and understand where they fit within our realm of antimicrobial resistance control efforts.
So originally the topic of high readmission rates to the hospital for our patients from nursing homes to inpatient acute care came up, and it was one of our committee members, Sean Dahl, who mentioned that we should connect with Dr. Huang, and her preliminary data was so impressive that we searched to find whether her results could translate to some measurable benefits for our Medicaid patients. And remarkably, there was a 61% decrease in inpatient expenditures. So based on the savings that we actually saw in 16 nursing homes, we were able to decipher that if all of the nursing homes in Orange County had participated in this infection prevention program, that there would have been a $4.5 million cost savings. We would certainly encourage all Medicaid agencies that are administering nursing home care to participate in such a similar program.
For the future, we're incredibly pleased to have just received a large grant from the National Institutes of Health to better understand how MDROs, or multi-drug resistant organisms, are spread in nursing homes. This particular project, called Gemstone, is looking at simultaneously understanding 6 particular multi-drug resistant organisms. Every day is a day that we can prevent infection and save lives. It's been an absolute privilege to work in this space.